Welcome to Health in Today's Woman. I'm your host, Dr. Kelly Williams. As always, this show is designed to help women become champions of their own health care. Tonight we're going to discuss a topic that all of our viewers have either been touched by themselves or by a family member. And that's the whole idea of coronary artery disease or heart disease. It's estimated that 13 million Americans suffer from some type of coronary artery disease or heart disease. Some people think this may be actually low and be somewhat underreported, and probably is even more patients than that. Tonight we're very lucky to be joined by Dr. Britt Miaton, an invasive cardiologist at St. Thomas Heart at the Middle Tennessee Medical Center in Murfreesboro, Tennessee. Now I want to take a couple of seconds because Dr. Miaton's arrival in Middle Tennessee is kind of an interesting scenario. Dr. Miaton and his partner, Dr. Falterman, are both from New Orleans, where they started a cardiology group on the west bank of New Orleans and were there for approximately 20 years. They arrived post-Katrina to the Middle Tennessee area. And I will tell you, from knowing Britt as a person, that this is an incredible opportunity and advantage for the Middle Tennessee area to have two such excellent physicians arrive in our community. Now, Britt, I just want to thank you for being here. I think I really appreciate you taking the time.
Well, thanks, Kelly. I enjoy it.
And I really want to kind of start off by just talking about, a lot of people don't understand what cardiologists do. So I want to kind of start there. What is a cardiologist's main job?
Well, cardiologists are board-certified internists that do some extra training specifically in cardiovascular disease. And our role is to diagnose, treat, and really, if possible, prevent the development of coronary artery disease or blocked arteries in the heart or other problems affecting the heart muscle directly.
Now, I know there's something I mentioned at the beginning was the fact that you're an invasive cardiologist.
Right.
And I know there's an invasive and a non-invasive cardiologist. Can you explain to me a little bit about what that means?
Well, invasive cardiologists, Kelly, are cardiologists that have done further training, specifically in diagnostic angiography, and actually interventional cardiologists have the ability and the training to insert balloons and stents into blocked arteries for the purpose of restoring normal blood flow to arteries.
And I want to make sure we kind of take a break here because I want to explain a little bit about what angiography is, because a lot of times in medicine, as I always say on my show, we tend to use big words and not necessarily explain them. So I want to take a second to explain. Angiography basically means you're taking an actual real-time visualization of the heart, the vessels in the heart. Is that correct?
Right, Kelly. Coronary angiogram or arteriogram is a study done under sedation, takes a very brief period of time, 10 minutes or so, and it's generally done through a needle stick in the upper part of the leg and allows us within a short period of time to pass a catheter up the artery, up the aorta, to position it in the arteries of the heart and take pictures, which allow us to see if there are blockages or not, and then act on those findings.
And one of the things that's amazing to me is the fact that it's just a 10 to 15 minute procedure. I mean,
yeah.
This seems like such a large, I mean, the heart is the most important organ in the body, and to be doing that in 10 to 15 minutes just sounds like an incredible opportunity.
Right. Yeah, as we've talked before, interventional cardiology is a field which has just blossomed in the last 15 or 20 years, particularly with the advent of intracoronary stents. It allows us to open arteries in almost a permanent fashion. These stents generally have a very long life and in some cases seem to be as effective as vein bypasses. But the chief benefit in terms of an interventional cardiologist's role these days is in terms of being able to interrupt a heart attack in its tracks, to actually stop a heart attack in its tracks through taking a patient having a heart attack to the cath lab and opening that blocked artery.
And I want to take a second here because this is such an incredible thing that Murfreesboro has this now, is the ability to take a patient who is having a heart attack and really change outcomes. And I think that's something that's so incredible that we have in Murfreesboro that we haven't had in the past.
Right. Yeah, I think that's one of the things, Kelly, that really attracted me to come to MTMC as a member of St. Thomas Heart. Previously, the huge majority of people that presented to the MTMC emergency room, which by the way is one of the busiest emergency rooms in Middle Tennessee, had to be placed in an ambulance and shipped to Nashville while the heart attack was in progress. And we now have the ability to take those patients to the cath lab here, get the vessel open, and the fact of the matter is our performance here our door-to-balloon times, which is the parameter by which the success of a program of this sort is measured. The national goal is 90 minutes. Our door-to-balloon time's 50 minutes here. So it rivals that of the hospitals in Nashville. We're very proud of that.
Well, and I'll tell you what, as I said earlier, I know you personally. I've known you, especially with the connection from New Orleans and me having gone to medical school there. But I have to tell you, from the people of Middle Tennessee, we have to tell you thank you for coming here. Because I think it's a tremendous opportunity that we've been given in a town the size of Murfreesboro to have quality heart care in this community is incredible. Now, I want to take a little bit of a turn here because I know that this isn't what all y'all deal with. I know that catheterization is part of it, but I know that you can see other patients too, and I think that's important too, that not everybody you see is having a heart attack, but you do have other heart issues that you see. Can you describe to me some of the things that you do see that are not necessarily related to heart attacks?
Well certainly. We clearly we take care of people that have had previous heart damage, whose heart muscles may be weak and whose functional capacity, their ability to do their day-to-day activities may be somewhat limited as a result of that. And through programs to monitor their weight and adjust their medications, we've been able to restore those people to a little bit better quality of life. And of course, we handle irregular heart rhythms and high blood pressure and general nuts and bolts cardiology problems as well.
When we come back, we're going to take a look at some of the tests that cardiologists do to help them better evaluate the heart. We'll be back after these messages.